Greetings again, this is Dr. Bill Wyatt with another video on orthodontics, and we're going to talk about a pediatric or adult method of dealing with class 2 elastic wear. A lot of people wouldn't wear the class 2 elastics, so I came up with an idea that would virtually make the person wear the class 2 elastics. In other words, you leave them off, it makes your four front teeth hurt or get sore, and so you have to put the elastics back and leave them in there, and they move the teeth back, just showing what the constant wear, how quick it works in this particular case. So this is going to be a lot of pictures in here. I'll try to go as fast as I can with it. Let's get it going here. This is a young lady that came in, and she had a class 2 malocclusion problem, and she's 15, I think, in 8 months, and this is 1986. And here we came in and we rigged up this so that she had to have the elastics in there to counteract the force that we're going over. And this is just showing it on the x-ray. I'll have to come back and show it to you on the teeth. You drop it down and you wear the elastics, and it pushes this spring back against these teeth with a certain amount of force. And if you take the elastics off, then the force of these springs pushes these four front teeth in a forward direction, and it's totally there. And it really gets uncomfortable, so you have to wear the elastics in here when you do that, so when you take it off, you wear them. Now this is just an intruding wire which levels this out on the bottom arch right there. She's got the wisdom teeth and everything in there. And here is another view of it. And I'm going to go jump right ahead. And so here we had no room on this girl. Is pretty well grown, so we had to get somebody take the wisdom teeth out right there. And this is 1988, 8/29 of 88, and she's age 17 and 2 and 11 months, almost 18 years old when we started. Now this is finishing the thing up, and we took the wisdom, recommended removing the wisdom teeth. So here's the cephalometric when we started. She had a 1/4 inch class 2 problem here, where the lower jaw was back about 1/4 inch. You need to bring it out or bring these teeth back to line this up. And that's the cephalometric on it. And here, this lady, we told her when we built this thing, just wear it about 2 weeks, and I want you to come back in and let's see what is happening. So this went from a class 2 situation to this next visit. She came in after 2 months instead of 2 weeks. And the teeth were like that. In other words, it put her into a class 3 situation with the lower teeth sticking out in front like that. So it overcorrected this, and then this in just a very short length of time, showing what constant force would do here. And so we took this off and just let it set, and so did nothing to bring it back, and it moved back to this point here on its own, and with an almost identical overbite and overjet and everything else. Let me go back to this and see when we first started, you see, let's erase that. When we first started, the upper teeth were out about 1/4 inch in front of the lower teeth, and the bite was closed a little bit. So we put that on, and she wore it for about a couple of months. And she came in, it was reverse of that. So we took the elastics out and put an regular arch wire in there, just left them to see where it would go back, and it went back to almost ideal situation. So here, this is 1986, and here is the case. In other words, we wanted this cuspid to come down in this blue spot right there. In other words, you're going to have to bring this forward some, and then this back some, and you'll get this spot back into there. And that's what we were after when we started this. Same thing on the other side. You're going to connect this up. In other words, this will move up a little, and this will move back some, and this dot will be going right down there. These teeth will be in this area. And this one right here, this bone will be back there. And everything, when we were pulling with these elastics, these teeth were straight back here when we started. And we put the elastics on there, these teeth will move out buccally. And the arch was narrow, and so we enlarged it. We built it out, something like that. Now we've got it lined up like that, and the class 2 problem is still there, see. So now we're going to come in and put something up here that pushes out. We'll put a spring on this, and when you take the rubber bands out, the force of this spring will be against these 4 teeth, and it'll make this uncomfortable, so the person comes back and puts their class 2 elastics on, and they'll wear this class 2 elastics constantly, and it'll amaze you how fast it'll go. Now that's just before we rigged it up on that what we call the finishing part of the model. Now that's the lowers. Now here is the appliance. We come off from here with a rectangular wire, drop it down into these 4 front teeth, not on the cuspids. It was up above the cuspid. And we push this spring back, and we give it so many ounces of force that's off here. And when we put hooks in here well, the hook is right here, and we wear the elastics. And when you've got the elastics in here, your elastic will have about 2 ounces more than the spring does. And so that when you put the elastics, it takes this spring pressure, pushes the motors back in this area, and this is a rectangular wire in these clear brackets right here. Now here's the hooks and the class 2 elastics. Go back here, and you put this in, and there's a 1/4 of an inch. These teeth, the bottom front teeth were here, and the upper front teeth were out something like this. And we said, we'll get back in here in about a couple of weeks and see how this is done. And so when the lady didn't come back, in other words, this goes, we put a bend in there to keep that from coming out. So she was wearing this thing constantly when she left. And so she came back in, and these spots were overcorrected. In other words, that red one went back like that. All right, we've got it back now. It's kind of it's moving back in that direction. The young lady came in. She was wearing the elastics, and this was lined up like that, and she was in a class 3. In other words, it went from here, and now it's back way over treated. And the young lady said, seated her, came and said, "Dr. Wyatt, you're going to come look at this case. This is really way out there." And so I came in there and I looked at it. I said, "Well, you're going to have to stop wearing the elastics." And we just took this off, and we put a little flexible wire in here and let her go home. And I wanted to see her back in 2 weeks. And so she came back in 2 weeks. And now when you you're wearing this elastic, and just the constancy of it, this is an intruding arch to level this thing out. The constancy will speed up the correction. And this girl was as tall as I am, and she's a big girl, not fat, but just plain large. And it corrected this thing in 2 months' time. We had it over there. So we put a little single wire in there. I may not have a picture of it, and just let her go home with that wire. Now here it is. Now this is just a little flexible wire. We just push this in, said, "Don't wear elastics at all. I want to see you in 2 weeks." And this was down on this. We left it like that. And so she came back in about 2 weeks' time, and this point right here that was out about here to start with, and it pushed it back and went past where we wanted it. Now, and so we turned her loose, and we got her back in 2 weeks, and it was like that. In other words, it finished thing up. We need to do a little bit of midline where we just line this up, and the thing is, their case is finished, the class 2 correction, in 2 months, actually. And so it ended up just pulling in just like that. And another interesting thing, Matt, I got this fixed and everything was going good, and his mouth was back and the teeth were fitting in class 1, and she came in one day and said her jaw was hurting. And I said, "Oh gosh, what did we do that had some effect on the jaw to make it hurt?" And I asked her everything we could, and I left and went in to work on somebody else while I was trying to think about what on earth had happened. And the young lady that stayed in the room with her came running in there to me and says, "Dr. Wyatt, she was in an automobile accident just a couple of weeks back, and somebody hit her on the side, and it knocked her out of the car on the other side, and she just forgot to tell me." And that was what was causing the joint problem up here. And I thought what we had done had caused it, but it did not. It didn't have anything to do with it. It just fixed it better. And so that was something that gave me a lesson. I always find out to ask somebody, "Have you been in an automobile accident?" They just flat didn't tell me about this. So we went ahead and treated it out and kept it in place for a while, and then took her out of this and finished the case like that. So thank you for watching. And if you have somebody that doesn't want to wear elastics, or they just forget about them, you can put this on somebody, and if they don't wear the elastics, that spring pressure, now this is all off now. it'll show those teeth out the front. I had one kid that did that. I mean, he would not wear them anyway, and it pushed his front teeth out further. But we finished her up like this. And I'll thank you for watching. We put her in a retainer. This is to help the jaw joint problem she had, and pulled her teeth out in that method. We did away with that and just put her in a retainer. But that's the splint like we used. And that's that. So if you have somebody, this works on kids or adults or anybody that's wearing class 2 elastics. You fix it, you line it all up, and then you fix it where you got a rectangular wire and your front teeth go up like that, go back and put spring pressure on it, and then put 2 ounces more elastic force than the spring pressure. So that keeps this under pressure, but just the 2 ounces on each side move the teeth back like that. Thanks for watching, and I hope you'll reason this one out, and we'll see you later.